back to the questions for Dr. Tom. Are people recovering, Tom, that you've heard of, seen? If so, what is the treatment for people with coronavirus? I mean, because no vaccine, right? No antibiotics? Do it just play through?
Well, right now, there's a lot that we don't know because we're hearing about these folks who are struggling in the hospital, just trying to survive. We do know that the physicians and the nurses are working hard, throwing a whole bunch of type of combinations of medications to try to find out that what works. They're using combination of things that have been old school medications, some new school medications, but really the treatment is supportive. It's just trying to decrease the damage that's being done by the coronavirus in the lungs. So that's why the ventilator, we hear a lot about that. That's why the need there is so great. But they're using steroids. They're using a whole bunch of things to try to survive, help these people survive. That's what they're doing well.
Well, to piggyback on that, so most people, if you're at home and it gets really bad, what you're going to get at the hospital that you're not getting at home is the ventilator, correct?
Well, you're at the hospital, you're getting a lot of intense treatment. You're getting oxygen, you're getting medication, steroids. They're giving you medications that you would normally not just get from the primary care doctor's office or something you can get over the shelf. So it's different. It's distinct what they're doing to help people survive if they do survive with coronavirus.
So one thing that we also talked about before was ibuprofen, which has become a little bit controversial with the treatment of COVID-19. A French study came out, World Health Organization said, you know what, maybe you should avoid ibuprofen and muscle relaxers. What say you?
Yeah, well, one study does not make it a fact, okay? So widespread use of ibuprofen has been used to lower fever, treat body aches and whatnot. So that is an option. It's still a problem. Majority of people we're using steroids in the acute side for people to help them mitigate this inflammation that's going on in their lungs and across their body and some symptoms. So I would say for folks, it's hard to make a decision. We don't know about that specifically based on one trial. I would say there's alternatives though. Look at the alternative that Tylenol, for example, to lower the fever is something that can be done.
You mentioned a steroidal. You know, from my situation in the winter, I get a horrible cough and I take prednisone to try to reduce that. Is prednisone something that I should and other people should avoid if we think we have this?
Well, this is what I would say. You have to know your condition, follow the advice of your specialist, your primary care physician, and so that's tailored to one thing. So, you know, allergies are different than what we're talking about COVID-19. So they're different physiology that's going on. The damage is different. The inflammation is different. So the people, when we talk about steroid use in these extreme cases of when there's a lot of inflammation in the lungs, that's what we're talking about. But you know, there's people who are on steroids for arthritis, for seasonal allergies. Just follow the directions of what your physician has recommended for you.
Yeah, don't overdo too much at home without talking to your physician. I know ibuprofen and Tylenol probably okay. Okay, what about diabetics? Very concerned about COVID-19. Are they at higher risk? That's the question.
Well, anyone with chronic disease, chronic health problems are at risk. So are diabetics at risk? Yes, they are. What should they do? Do the same thing everybody else does, including taking their medications, not stopping their medications, continue their follow-up appointments as needed, because we have to make sure that a lot of this, the things that we're recommending, people stay indoors and social isolate. There's people with chronic medical problems that still need to be managed, so they still have to be in contact with their primary care physician or their specialist.